Hi everybody, or whoever's watching. I said in my last video that I was going to make a couple more this week to go into more detail about the post-op and the stay in the hospital and the pre-op. I got those backwards, but oh well. Well, the pre-op diet, my doctor specifically, he had where I had to drink a Slim Fast for breakfast and a Slim Fast for lunch. And it could have been the Special K. It's whatever protein drinks works for you. But I personally like the Slim Fast. They went down a little bit easier because I don't like those drinks at all, really. But the Slim Fast was really good. And he advised a protein bar with each thing, and then a small meal for my dinner. But I talked to my nurse and everything, the nutritionist up at my doctor's office, and she said that a lot of people substituted lean cuisines for their small meals. You just had to keep it under so many calories, and to make sure that you weren't eating what was prohibited on the list. And that was basically pre-op, 2 weeks of a diet just like that. And for my stay in the hospital, well, that was something. My surgery, as far as I know, took longer than expected. It made my husband really worried because my doctor said it's usually an hour 15 minutes, and I was in there for 2 hours, and it turned out that my liver was already infiltrated with fat tissue, and that my blood sugar was up there almost declaring me diabetic. So I had a few complications, and my liver didn't shrink the way it was supposed to because of the fatty tissue, but it didn't go down like it was supposed to with the diet. So they had a few complications while I was in surgery, and I guess that led to the pouch being swollen afterwards, because in the hospital afterwards, my doctor said that usually people stay only about one night, and I was in there for 3. He said most people only stay maybe 2, but my pouch had swollen up, and I was throwing up the blood and the dried blood from all the staples and everything. But the pain medication actually works, thank God, because that was just excruciating. When the pain medication started wearing down on me, I was pressing that button. I needed my pain med because that was just horrible. And the nurses and doctors are telling you to get up and walk around, and that it alleviates the pain and that it helps you heal faster. And I just could not. I could not even lay on my side. I know that you see videos on YouTube where, you know, some patients lay on their side in the hospital. I could not lay on my side. I don't know what, but they took my morphine drip after so long. I think I got to keep it for 24 hours for one day. And after that, they gave me shots. And my pouch was so swollen that for 2 of the days I was in there, I was in there for 3 nights and 4 days. But for 2 of the days I was in there, I couldn't eat anything. Could barely eat ice chips because of my nausea, and they were afraid that, you know, the vomiting motion would hurt my pouch. So they had me on an IV drip the whole time. And I'm sure they do that for everyone, but that's basically how I got my nutrition for the first little while. Let's see. It was just a painful experience. And when I got home, they call that first week Hell Week. If you look it up on the internet, it's called Hell Week because that's exactly what it is. It's pure hell. And the band, your doctor advises you to ask for an abdominal binder. Do it. I was so big that in the hospital it didn't fit around me. They tried to stretch it around me, but it actually made me scream because the pressure was just too much and too painful on everything being, you know, newly cut into. But when I got home and I got it to go around me, barely, I felt that I could walk around better. It really really holds everything really tightly in, and it helps you walk around a lot easier because nothing's hanging down or anything. It's just keeping it in place, and just took the pressure off my back and everything. It was great, actually. It really helped, and I still use it. I'm 2.5 weeks post-op, and I still use it to help me sleep because now I can sleep on my side, but it helps keep everything really close, really compacted. And I don't wear it all day anymore. I was to the point where I was wearing it all day, but now I kind of wear it in intervals when my back starts hurting from standing a certain way, because you realize after surgery that your side kind of hurts, so you kind of lean a little bit, and I was doing that too much, so I needed to stand up straighter, and that helps me. But 2.5 weeks out, I'm doing a lot better, but you have to listen to the doctor when he tells you no lifting over 10 pounds, no bending over, no stretching, no reaching, because I've been doing that because I have 2 kids and I have to bend down to clean and to get stuff, and I have to reach up to help them get certain things off shelves and foods and cook. And I did it last night. I went grocery shopping while my husband was asleep, and I had brought the groceries in by myself, which is a really, really dumb idea. But it hurt, and I'm hurting today, and I feel like I'm swollen for some reason on my lower abdominals. But just listen to what the doctor tells you, and don't eat anything you're not supposed to. I'll go into that later because I experienced something due to the pain medication and due to eating certain things, and just do what the doctor tells you. That's the best advice that I can give you. And that's my update for pre-op, operation, and post-op. So comment, subscribe, view, like, anything. But I'll make another update either tonight or tomorrow about the complication with the medicines and everything. Thanks.